Good morning, everyone, and welcome to Voices of Healing and Justice by the Mental Health and Social Justice Clinic. We are live with you this morning as we discuss mental health and social justice. My name is Dr. Anissa McNeil, and I am the founder and executive director of our clinic. Let's take a moment and introduce our co-host this morning. We're going to start with Miso. Good morning, Miso. How are you?
Morning, Dr. McNeil. I'm good in yourself.
I'm doing very well. Can you introduce yourself to our audience?
Morning, everyone. My name is Misokuhle Mhlongo. I'm a qualified and registered clinical psychologist and have been practicing for 12 years now.
Wonderful. Good morning, Miso. Wonderful to have you. As well as we have our other clinician with us this morning, Terrence. Can you introduce yourself to our audience?
Good morning, Dr. McNeil, and good morning, everybody. I'm Terrence Msiza. I'm an educational psychologist, somebody who's so passionate with supporting mental health and the well-being, especially amongst young people. That's who I am, and most interested are amongst young people and the families. And I'm so excited to join us and the space. And I hope this space gets to grow and let's get everybody diving in.
Wonderful. If you could follow us on our app, we do have a mental health and social justice app. You can follow us on YouTube, on Facebook, on Instagram, and on WhatsApp. If you're not able to catch this broadcast, it will be rebroadcasted tomorrow. So please like, share, comment, all of those wonderful things on our social media platform so that we can get to know one another. So Terrence and me, so as we say, get to know one another. Well, that's exactly how our clinic started. How did you know that we started this clinic by getting to know what were the needs, what were the wants, what was happening in South Africa? So our clinic began in 2023, and during that year, we had a team of registered therapists, from education therapists, clinical therapists, social workers, registered counselors. We had a team of registered therapists be able to go out and do focus groups so that we could hear the voices of the community. So we gathered together. We gathered at churches, at schools, at parks, at community centers. We gathered at your local spot, in your neighborhood. Everybody gathers at this spot. So we gathered at the spot. We went and we brought food, we brought drinks, and we said, hey, can we get to know you? And what we learned about South Africa, and before I get into that, Miso, I want to be able to tell everybody that we did this in all three provinces. We did this in Johannesburg, in Durban, and in Cape Town. And that effort took us 8 months. It took us 8 months to get to know you. Does that we sat down, we went to the spot, we went to your school, we went to your local library, to your community center, and we had dinner, we had drinks, and we said, tell us about mental health. And this is what we found out. We found out here in South Africa, especially to the general public, mental health is not so accessible. So what do we mean by that? So in most communities, to receive mental health services, you would need to go to the government hospital. The government hospital, you will stand in a long queue. Wait a minute, Dr. McNeil, you just said stand in a long queue? Yes, there's a long queue. And when you stand in this particular queue, most people say the entire community will know that you need help because you're standing in that queue. So you stand in this long queue and you go to the hospital and you say, I need help. But guess what, Terrence? If you're not at harm to yourself or to anyone else, the hospital won't admit you. The hospital will put you on a waiting list so that you could receive counseling by one of the counselors in the hospital. Does that make sense? That waiting list can be so extensive, Miso. That waiting list can take a year, 2 years to get to you. When that waiting list gets to you, there's no guarantee that if I'm able to talk to Terrence today, when I have my follow-up appointment in whatever month, I may not be talking to Terrence. I may be talking to someone totally new. So, number one, we found out that the government system has a long waiting list. And in that waiting list are inconsistent and prolonged services. Does that make sense? Like, I want to be fair to all of our government hospitals and everyone that's listening. We're not saying that the government hospitals won't help you. Yes, they will provide some services, but those services are long awaited and they are inconsistent. But that person is depressed or sad or has anxiety or maybe having symptoms of schizophrenia today. So, how does an appointment, Terrence, in a year help the person today? How does it help you live in your community today? So that's what we found out about government hospitals. There were very few people. There were about less than 5% of the individuals that we talked to in our focus group that could outright afford therapy. Dr. McNeil, I can pay the 950 Rand per session. My child has therapy. We go to a private therapy. We're talking about less than 5% of all of our focus groups are able to pay outright. Does that mean it's not a challenge for them? They can have private services. That leaves more than 95% of our population with lack of access to mental health. So then we go to the Western Cape. And in the Western Cape, Terrence, we go up into the area where there are farms and there's all these types of beautiful things out in the Western Cape. But as you look at that beauty, mental health is even more of a challenge. So, what we learned, and I didn't know this about the Republic of South Africa, is that there is this mental health bus. There's a bus full of practitioners that goes around to every province in the Republic, and they provide mental health services. And I thought, oh, wow, that's wonderful. You all don't need to leave your community because their community is pretty remote from Cape Town. And you don't need to leave your community. The bus will come to you. Well, guess what? The bus only comes once a year for 2 or 3 or hopefully a week. So in those 2 or 3 days or whatever time that bus is there, that's when you get mental health services.
Yeah, as you are saying, Dr. McNeil, it becomes a bit of a social construct, and that led us to what I would also in getting to know us from our audience, like for us and for Miso to Miso, please explain or just share your thoughts for us in terms of the stigmas that in specifically our communities that they do have pertaining the mental health, and how do you find it?
Mm,
Well, Terrence,
mm,
we're not quite at the stigma yet. We're kind of still at the getting to know you. Because when we get to know the community, we're getting to know what systems are in place in the landscape. Does that make sense? Before we get to what the people think, we must know what systems are in place in the landscape. And
Mm,
so, oftentimes in the Republic of South Africa, you will hear what I like to call a dystigma. Oh, people don't like to get mental health. But if we never tell you the systems that are in place, you would believe that stigma. Does that make sense? You would
Mm,
believe, oh, they just don't want to go to mental health, but you don't know that the mental health bus only comes once a year.
mm,
It never has the same providers. You don't
mm,
know that the government hospital has a queue, and once you stand in the queue, you wait on a list and you may get services 2 years later. Is that you don't want the service? That you don't believe in mental health? Because you got to remember,
mm,
you were courageous enough to stand in the queue so that your whole community could see that you need help. So that's why this part is so important that we tell you what's the landscape in South Africa before we tell you the heart of the people, because you will miss the heart of the people if you don't know the landscape.
mm,
Does
mm,
that make sense? So think that's a
mm,
great question, Terrence, and we really are
mm,
going to tear into that a little bit later. But it's important that you know what happens here in the Republic of South Africa. So now let's talk about this middle class. We talked about the class that said, "Hey, I can go, I can get services at my for my particular family member, or I have a job and my job can provide services for me." And then we talked about the individuals here in the Republic of South Africa that may be on a social grant. That
mm,
social grant is a subsidy that is provided by the Republic because that individual may be unemployed. There's a number of factors that while you may qualify for a social grant, and those individuals access the hospital. So now the government hospital. So now let's talk about our focus groups and what happens to this middle class, Miso. What happens
mm,
to the class of individuals that work a little bit, maybe have a temporary job here or there? Because what you'll find within the Republic, and I didn't know this until we had all of these focus groups, is that people aren't, when they receive a job, the job may be under contract, meaning that they may have a job for a year, for 8 months, for it's under a contract. So unlike my reference point in America, when you obtain a job, you have this job for X amount of years until you quit the job. That's not the case here within the Republic of South Africa. What happens in the Republic, you are hired under contract, and that contract can be for 8 months. So you have individuals that, because of the need for resources, remember this, the need for resources, they don't miss work. They don't call out sick. They don't go to the hospital when they don't feel
mm,
well. They
mm,
are not going to a mental health service versus going to their job. I'd rather eat than talk to a person. I'd
mm,
rather eat than somebody to tell me what's going on in my mind. Now, this is obvious. I'll never forget this. One of the ladies said to me, "Dr. McNeil, you're asking us a rhetorical question. Don't you know that we're already stressed out?"
mm,
So that's why it's so important to know the systems. If you don't know how the system is set up, you will blame the people. And I loved her question, like Dr. McNeil. Of course we're stressed out. Of course we're depressed. Everybody's thinking about the end date on their contract. She worked as a seamstress here in the Western Cape. She sold drapes. And she said, "So I'm thinking about what am I going to do when this contract wears out?" Of course I'm stressed. No, I'm not going to your service. My kids are currently in school. I must pay their tuition. I must pay for their uniforms. That doesn't stop. Now, she said something that was critical. This is critical to know in mental health services. She said, why doesn't the service come to us? I love that question. You may say, Dr. Me, I learned so much from that. If we work within the Republic of South Africa, we know that the majority of the people in South Africa are living paycheck to paycheck or no paycheck. Why doesn't the service go to them? Why doesn't the service just say, here we are? Then as we have the focus groups, I think this was in Johannesburg. This happened in Johannesburg and Durban. The young lady said to us, she just graduated from college. She said to us, why do we always get the intern? Every time I have looked to receive psychological services, it's been from an intern. We never get a registered person to really help us. How many of us knew that the community feels that way? That all the poor people get the intern. They don't get the registered counselor to come out and help them. They get the people who are learning. And then we must ask ourselves, who are the most needy in our community? Is it not the people without the resources? She said, so why do you all always send your interns to us? Does that not, so the system feeds this stigma or this prescribed stigma of you can provide the service, but the people won't go. No, the people are not going because they're tired of the cycle. We get student number one, student number two, student number three, and it's not continuous care. But we blame the people. We don't blame the systems. But you have to know the systems that are in place before you can blame the people. Does that make sense, Terrence? So before we talk about stigmas, we have to be able to talk about stigmas in context. Why does that exist? Why do the people feel that way? Then the last thing I would like to say, as we spent all of this time, this was wonderful time of getting to know this community. Well, as we spent this time together, it was very salient in each community, in each province, in each area, the need for consistent, highly qualified services. Consistent, highly qualified services. So then, Miso, you asked me, Dr. McNeil, why don't you hire interns at our clinic? Because there is a need for consistent, highly qualified therapists. Does that make sense? So we began our clinic by listening to the people. You have to be able to listen to the people and hear what's going on in the Republic so that we could build a system, a clinic that spoke directly to what was stated to us. Does that make sense? So our clinic speaks directly to what was stated. So that's the reason why we don't hire interns. What's the reason why we go out to the community or we offer free online services? Because the community asked us, come to us. Why are you all sitting up in the ivory tower saying, hello, come to therapy? You need to come to us. That's why we go to the community. The second and most critical thing was this. And you could hear it in Johannesburg, in Durban, in the Western Cape, here in Cape Town. You could hear this through in all three provinces. Dr. McNeil, do not forget I am African.
Mm.
So as we were there and we held these focus groups were held in 11 different languages, from Afrikaans to isiZulu to Xhosa, 11 different languages. The one sentiment that everyone said is, don't forget, I'm African. We have different cultures and different traditions. So when we talked about, oh, we offer drumming, they said, oh, good. Yes, I like to drum. They weren't so keen on yoga. Some of them didn't really know what yoga was. They kind of understood mindfulness. Like, okay, I kind of understand that. They definitely understood the drumming and the dancing. So that's why we offer those somatic services so that we can, one, connect to the traditions that are alive and well here in South Africa, so that you don't have to leave who you are to come to this little square box called therapy. There's so much healing that can go on in a dance circle. There's so much healing that can go on in a drumming circle. So we put our registered therapists in the drumming circle. We put our registered therapists in the dance circle. One of our registered therapists, actually our social worker, she runs our meditation and yoga. So there's so much healing that can happen with who you are and what you naturally do. The second thing to this was the social justice piece. So why are we the mental health and social justice clinic? We're social justice because when you go to work and you're stressed out, Miso, could you forget your purse? Could you forget your registration booklet that you need for some other appointment? When you're really stressed out, especially financially, can you forget those
Mm.
things? Mhm. So
Yes,
forgetfulness is a common
absolutely.
symptom of anxiety. When you're depressed, Terrence, could you almost forget your taxi stop if you're depressed?
It does happen. It
Yeah,
does
you're just
happen.
riding. You're just riding.
You're
So
floating.
it's important for us to work with our social workers to help our community members re-engage with the community. And then when they have a bigger, what I like to call, when they have a bigger misunderstanding in the community, that's what I call the Willy Wonka and the chocolate factories. When everything goes Willy Wonka in your community, that's when you may need a mediator to come out, Miso, and say, hey, okay, this tuck shop may not understand that you're counting your money because money's tight for you. They want you to hurry up and pay and move on. And so you may have a disagreement in that shop because you weren't hurrying along as the shop attendant need you to do. So we have mediators to go out and to talk about that woo woo and wah wah. We want to be sure to get along in the communities. And sometimes it's a little bit more than that. Sometimes we do need an attorney to make sure that we have social justice in the community. And we do have attorneys to help us with that. Our clinic, from listening to the people, from hearing the hearts of the people, we have decided that mental health and social justice go hand in hand. You can't heal somebody's mind and not heal their community. You can't. It's the same way we talk about in family therapy. You can't take one member of the family and have therapy with this one member and think that you have healed the entire family of 7. You have not. You've put this one person back into a dysfunctional environment. So that's why we have social justice. So you may ask me, so Dr. McNeil, you spent 8 months getting to know the people. Absolutely. Getting to know what they needed, what was required, was asked for. But this clinic is by South Africans for South Africa. And so I am the only American, and this is the first and the last time that you will see me on this podcast. And that's the same way that we operate in our clinic. I'm behind the scenes. I only hire South Africans. And all of our team members, I think, Miso, we have 8 or 9 languages spoken in our clinic. What is your mother language, Miso?
Mhlongo is Zulu speaker.
Okay. So can you say good morning to our audience in isiZulu?
Sanibonani emakhaya. Siyajabula ukuba nani namhlanje ekuseni. So good morning to everyone at home. We are happy to be with you today morning.
Wonderful. And Terrence, what is your mother language?
My mother language is isiNdebele. So with isiNdebele, it goes as Akwandre Luchani, which simply means good morning today. And singathabela ukuba nani imihla nemihla sichikije ihlelo lethu langemihla. Simply that means we are pleading with everybody to tune in with us every week where we going to impart the journey together.
Wonderful. So I am so pleased that they were able to share with you their mother tongue. So get used to that, everybody, because every week that we come live on our podcast, our registered therapist will speak to you in their mother tongue. Does that make sense? There's some things, and that happens to all of us. There's some things that automatically come out in your mother tongue because they're just that natural to you. And so they may say something in their mother tongue and then they'll say it again in English. But the reason why we have our therapist speaking to you in their mother tongue as a part of this podcast is because your mother tongue is never a secondary thought in our clinic. So you must know that when I was thinking about, okay, this podcast is going to go across in English, and I just said no. For social justice, we must have each of our therapists be able to talk about this is anxiety, then say anxiety in your mother tongue. This is how we do, then say that in your mother tongue and then explain it in English. Does that make sense? No one, everyone is valuable. Every language is valuable. So as many languages as we can bring that to you, we want to be able to bring that to you. That is, to me, not only social justice, that's just a great part of humanity, to be able to speak to you in the language in which you are familiar and you understand the most. Does that make sense? So as we got a chance to tell the people how we got started, Miso, what do you think about what we found out about the Republic of South Africa? Does it ring true for you?
100%, Dr. McNeil. It definitely rings true. The differences in those who can afford, those who absolutely can't, and those who believe there are other priorities besides mental health. And also just the fact that people say it's a Western concept of therapy. What I'd like to remind our viewers is actually therapy has been in the African culture for a very long time. When there are issues in the community gathers together under a tree, things are discussed. There's a specific leader who gets to facilitate the conversation. Even when there's family conflicts also are brought together. What is the issue? There's a mediator. And also even in regards to couples, if they have got issues, they have been brought in by different individuals, church members as well. So I just want to maybe the difference now might be an office space, for example. But otherwise, therapy, we have been giving each other therapy as Africans. And I think definitely within this clinic, it's just a further continuum of exactly what we have known, even our own ancestors have started it known themselves.
Absolutely. Terrence, what are your thoughts about what we found out?
I would like to echo it from both of you, Doctor and Miso, to say one, there's a huge contrast between those who might be a middle class, but due to they're so demanding in terms of life expenditure, influx rate. People that used to be in the middle class, they used to afford so much. However, with how everything has tended to be, they are not able to, even for themselves to provide. And I'm echoing this to what Miso has said to say now there's a prioritization that one needs to constantly think of to say, am I going for therapy, as Dr. you were saying, am I
Mm,
going for therapy or do I need to foot the bill for food? Do I need,
mhm,
there's just so much contact that is happening. And also just getting to understand what people concern are, I think it's exactly why the clinic is so needed and not just so needed, but it has so much purpose to offer to people to say, as much as there is these other things that are happening on our side, but you can still have the clinic in assistance because remember, those problems do not stop. The community, the
mm,
bills, they will continue to be flocking in. But what about your mental health? Is it taken care of? Is it at least are you doing something about it? Because if also there's nothing that has to be done, you could find yourself using yourself an opportunity to pay for those bills because you might lose your job because you are
mm,
unstable, or it might lead to the absolute debt. So I think
mm.
it what has been found out. It's exactly what it is. It's a big contrast. However, I believe the clinic has so much to offer.
Mm,
Wonderful,
mm.
wonderful. Well, it's been so exciting to be able to tell you how we started, what this was all about. Please go share this podcast on YouTube, on Instagram, on Facebook, like, share, comment. Be sure to follow us on social media so that you can get all of this information and so much more. But now we have something in store for you. We have other episodes that will happen every Wednesday at 6 a.m. We will have another episode. Miso, what do the people have for to look to next week? What will we talk about next week, Miso?
I believe Dr. McNeil obviously focusing now on exactly how we function as a clinic and our different roles. So mental health matters and issues officially are starting as from next week.
Yeah, so next week we're gonna have unemployed. Are you unemployed in South Africa? Are you anxious? We're also going to provide tips to help you with that anxiety. Does that make sense? That's going to be next week. And then after that, Terrence, what are we going to talk about in week number 3?
Week number three, we're going to be looking, I look fine, but I am not. This is one of the most common topic, In most cases, we have a certain projection of how people we want them to look at us because we do not want to look weak or life itself is so demanding. There's not so much time for you to look at yourself and look down on yourself. However, at times you might be looking fine, only to find indeed you are not fine at all. So that is going to be the third episode that we are going to be looking at.
Wonderful. And our fourth episode, Miso, what are we going to do?
We will be focusing on sleep matters and obviously taking into account that we've become such a technological society that often we are no longer giving ourselves the time to sleep, to rest, because we are constantly scrolling. So we'll obviously focus on those aspects, the dangers and the pros and the cons, sorry, and exactly how they impact our mental health as well.
Absolutely. And this is a topic that Miso and our entire clinic is taking up on a very serious matter. Please join us at the South African conference. We've submitted an abstract on using AI to help our society with just this. Most individuals are up scrolling on TikTok, scrolling on Instagram 2, 3 o'clock in the morning, not
Mm,
getting the
mm,
sleep,
mm,
not getting the
mm,
rest that they need.
mm, mm,
So we're using AI to say, okay, let's see how we can bring down your anxiety. Let's see how we can change the way you think using CBT. So that's so exciting. That's so exciting. Miso and Terrence is a part of that research. So we're doing the research on that. And last but not least, we have an episode coming, episode number 5 on natural healing. Many of us use a natural remedy. We don't use a pharmaceutical remedy for every need that we have. Many of us use remedies like myself. If my throat is scratchy, I don't go and get something from the pharmacy for my throat. I go home and I make a tea with honey and a herb and I drink that tea. That was passed down from my great great grandmother. Just we're going to take a natural remedy. We're not going to use something from the pharmacy for that. How many of us engage in natural healing? From something as simple as a tea or something that you may rub on your skin, a natural healing. It's a part of who we are as Africans. It's a
mm,
part of who we are.
mm,
So
mm,
it's so exciting. I'm so super excited to have her join us. We're gonna talk about how we link that, how we can work together. You don't have to leave who you are as an African in order to get therapy. You don't. You don't have to be afraid to tell us, oh, I'm sorry, I'm going to my natural healer. Great, great.
mm.
And some of you are saying, really, Dr. McNeil? Really, really. And some of you say, well, they don't call it natural healing. They call it voodoo. They call it witchcraft. Whatever they may call it, whatever term they want to call it that. But you're free to talk about that with us. And we're free to work together. I don't care what they call it. Call it. We're here for it. So I'm super excited about that, Terrence. I'm super excited about that. We are the voices of healing and social justice, the voices of healing and justice every Wednesday at 6 a.m. Please join us here on the podcast. And as we sign out, we're going to sign out with each one of our therapists, and then I'm going to close us out. But let us sign out from this broadcast today. Miso, can we say goodbye to our audience?
A good day to everyone. And hopefully, indeed, we'll meet up again next week so that we can really also hear in terms of what people are hoping that we also focus on, what people are hoping that they learn about, and knowing that as the as a social justice, mental health and social justice clinic, 100% we strive to be the best and to also give back hope in regards to the issues that Dr. McNeil stated that people had been concerned about when it comes to mental health.
Thank you, Miso. Terrence.
Just to wrap up, and I would love to close it in this fashion. Thank you so much for tuning in, and we're looking forward to the new episode with you. Not only that we are going to impact you, but also we are really waiting for those questions. We are really waiting for those interaction with you. And in closing, we want to say There's much for us, and there's so much from the clinic in terms of episode. Please tune in, please subscribe, like. For every week, we would like to see the community growing. Thank you. Have a lovely one.
Wonderful. Thank you so much for joining us on the Voices of Healing and Justice. Be sure to like, subscribe, comment on every episode that we have. Your voice matters to us. Together, we can heal and we can have justice in our community. Thank you so much for joining. Have a wonderful day. Goodbye.
Bye.